Hello, if you are just tuned in tonight and you are new to Osteo Boston, I just want to thank you for getting on. And if you're a member and if you're a YouTube participant, we're also excited to have you, and give us a thumbs up or subscription. Tonight we're going to meet the infamous Dr. Michael Holick, and I'd like to bring Amy up to introduce Dr. Holick.
Hi, tonight we are very pleased to introduce the endocrinologist, Dr. Michael Holick. He has an MD and a PhD from the University of Wisconsin, and he holds the following positions at Boston University: Shobanian and Avadishian, hopefully I'm pronouncing that correctly, School of Medicine. He's the professor of medicine, pharmacology, physiology, biophysics, and molecular medicine. He is also the director of Ehlers-Danlos Clinical Research Program, the director of Vitamin D Skin and Bone Research Laboratory. He is also the former director of the Bone Health Care Clinic at Boston Medical Center and the emeritus chief of the section of endocrinology, diabetes, and nutrition. In addition, Dr. Holick was the very first to isolate, identify, and chemically synthesize the active form of vitamin D that's used worldwide to treat metabolic bone disease. And he was the first to identify the major circulating form of vitamin D that's used to determine a person's vitamin D status. For 19 years, he's been considered by Castle Connolly as one of America's top doctors, and he is also nationally and internationally recognized for expertise in pediatric and adult metabolic bone disease. And here he is, Dr. Holick.
Thank you so very much for that kind introduction, and I'll now share my screen. And so I'm going to be talking today about delightful vitamin D. And hopefully, there we go. And talk about it from benefits from inception till death. 2025 perspective. People worry about conflicts of interest, so I consult for a variety of companies. I get support from NIH. Much to the dismay of the dermatology community, I get support from the Sun. Indeed, what am I going to tell you about vitamin D that you don't already know about? From the Institute of Medicine report back in 2010 and now the 2024 guidelines. Well, first of all, I knew I had to seek higher counsel, and who better to ask than this very famous doctor who basically told me I was an idiot, right? Because what am I going to tell you? In 2010, the IOM came out with its recommendations, and it recommended that before 2010, believe it or not, the recommendation for vitamin D was 200 units a day. And they realized that actually you probably needed 3 times as much. They also appreciated that vitamin D is not as toxic as we once thought, and you could easily take 4,000 units a day as an adult. Constantly interviewed by the press asking, what do I think about all this? I have one word: wow. There's never been a nutrient that's been tripled overnight. But the question really is, did they get it right? And so in 2011, I was fortunate to chair the Endocrine Society Practice Guidelines Committee, and all the members of the committee are experts in the field of vitamin D. And the objective was clear: to evaluate, treat, and prevent vitamin D deficiency, with emphasis on patient care. And so in those recommendations, for infants up to 1 year of age, 400 to 1,000 units a day; children, 600 to 1,000 units a day; adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more. The 2024 guidelines were different, right? In contrast to previous guidelines that broadly addressed evaluation, treatment, and prevention of vitamin D deficiency for care of patients, the goal of these guidelines was to establish clinical guidelines for the use of vitamin D to lower risk of disease in individuals without established indications for vitamin D treatment or testing. They depended on randomized controlled trials for most of their recommendations. They ignored association studies. I don't know if you know who Ignaz Semmelweis is, but this poor guy back in 1850, when he suggested if you wash your hands with chlorine water, you could prevent deaths of pregnant women during birthing. His colleagues thought he was nuts, put him in an insane asylum, and ultimately had the guards beat him up, and he died at age 40, 2 weeks later of infectious disease. So you have to be careful about these things, right? Is it true that vitamin D is an issue for Europe, for example? There's good evidence that indeed back in the 50s, before 1950, Europe and most countries in the world fortified with vitamin D. And then in the 1950s, when this outbreak of vitamin D, so-called intoxication, occurred, they became so fearful of it that they banned it in most European countries and throughout most of the world, except the United States and a few other countries. In 2024, it's interesting. They did not recommend any vitamin D for infants. They just ignored the literature, apparently. For children, they recommended, back to the Institute of Medicine recommendation, 600 units a day. And for adults, they recommend the same thing, 600 units a day. And for those over 75, they said if you want to survive longer, now you can take more vitamin D, 900 units a day. They had no recommendation for obesity. The 2011 guidelines, like I said, were very clear from the day you were born till the day you died, and we took into account obesity. So vitamin D deficiency is a major problem, and it turns out that I'll present you one case. And here's a 7-month-old female, muscle weakness, tetanic seizure, serum calcium of half normal, right? Turns out that this is the first lowland gorilla born in captivity in the Franklin Zoo in Boston. And it was the pediatrician was called in, convinced that this infant had some rare genetic disorder. There was nothing you could do because they gave the infant 400 units of vitamin D and it didn't do any good. So it turned out that mom was really getting upset because the baby was complaining, and dad was really upset. Have you ever wondered what he was trying to say? That's what he was trying to say. So indeed, they called me and I got to see this infant. Infant has classic wide epiphyseal plates, classic for rickets. So what do you do? Well, what I did was I gave the infant 5,000 units a day. Infant's feeling great. In fact, I was the guest of her first birthday. Mommy, will my growth be stunted? Because of her in utero and her first few weeks of life of vitamin D deficiency, she had significant growth stunting during her first couple of years of life. 1889 in Boston, 80% of infants had rickets. Is it a problem today, even today, right? With all the modern medicine, you better believe it, right? Mainly children, pediatric infants of color are at high risk. Why? Because it's thought that human breast milk contains all nutrition an infant needs. It's a wonderful source of nutrition, but there is essentially no vitamin D in human breast milk. So if you give your infant human breast milk as a sole source of nutrition, that infant will be vitamin D deficient for that period of time. Now, I'm not sure what Brittany's thinking about, but could she be at risk? And so we asked the question at our hospital and looked at 40 mother-infant pairs and asked the question, are fetuses and newborns at risk of vitamin D deficiency if they're getting recommended 600 units a day as recommended by the Institute of Medicine? We looked at 40 mother-infant pairs as they gave birth. We documented that they were getting at least 600 units of vitamin D a day. 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because preeclampsia, one of the most serious complications of pregnancy, we showed with Lisa Bodner many years ago, was associated with vitamin D deficiency. Higher the mom's vitamin D status, lower was her risk of having preeclampsia. We also did another study. Vitamin D is very important for muscle function, which is important for birthing. And so we looked at the incidence of C-sectioning at our hospital and related it to vitamin D status. And we showed that the probability of requiring a C-section was markedly lower just by being vitamin D sufficient at the time mom gave birth. Could this infant have been delivered at term if mom had taken vitamin D? A very nice study was done to show when you look at gestational age, 25-hydroxyvitamin D, 60% reduction in premature births if your blood level at the time you're giving during pregnancy is at least 40 nanograms per ml. Mom, thanks for taking your vitamin D. Prenatal vitamin D and dental caries, an inverse relationship with maternal 25-hydroxy-D and the amount of decay in infants. So here is the recommendation from 2024. We suggest empiric vitamin D supplementation during pregnancy, given its potential to lower risk of preeclampsia, intrauterine mortality, preterm birth, small for gestational age, and neonatal mortality. So that's fantastic. But look at this, right? They would recommend that to accomplish this, that you should be on at least 2,500 units of vitamin D a day. But what is their recommendation? This is what the recommendation is. A priori, decision general approach, panel focused on generally healthy populations. If you are healthy, apparently, and you are pregnant, that you only need 600 units of vitamin D a day, including pregnancy. I recommend to all of my patients, 2,000 units a day for pregnant women, minimum. How much does a mom need to put enough vitamin D in her milk to satisfy her infant's requirement? And this was done by Bruce Hollis and Carol Wagner several years ago, 6,400 units a day. And there's enough vitamin D in mom's milk to satisfy the infant's requirement. It's been thought by pediatricians that infants are super sensitive to vitamin D, so they were wary about giving vitamin D supplementation. But happily, we now recognize vitamin D is critically important from birth on. In fact, the American Academy of Pediatrics makes it clear, especially for breastfed infants, they need at least 400 units of vitamin D a day. This is your problem. Vitamin D is rare in foods. We did a study many years ago showing from the National Health Survey, looking at dietary intake of vitamin D, no one in the United States is able to get enough vitamin D from your dietary sources alone. Now, Star Wars, one of my favorite movies, and of course, one of my favorite of all time characters is this guy, right? And I always wondered what he was trying to say. So we finally had an interpreter come in and inform us. Exactly. It's well documented that obesity is associated with vitamin D deficiency, right? We showed, and many others have shown the same thing. The higher your BMI, lower is your 25-hydroxyvitamin D. We went on to show, and Best Austin Hughes and others have shown the same, is a bariatric surgery, taking body fat, you could show a very high content of vitamin D. It's stored in body fat. One of the questions you might ask is that if you've had gastric bypass surgery and you lose 50 kilograms of fat, are you going to wind up being intoxicated? And the answer is no. And the reason is that as your fat is being destroyed, so is your vitamin D. And so we showed that if you take a normal weight or an obese person and give them the same amount of vitamin D or expose them to stimulated sunlight, they have only about a 45% increase in their 25-hydroxy vitamin D. We also did a study in Canada and demonstrated with Ikwaru et al. That if you look at how much vitamin D supplementation and look at serum 25-hydroxy vitamin D, and you look at underweight versus normal weight versus overweight and versus obese, obese people need 2.5 times more vitamin D to raise their blood level to the same degree, taking the same amount of vitamin D. So that instead of 15,000, it would need to be taking almost 45,000 units of vitamin D a day. So they need 2 to 3 times more vitamin D. Recommendation 14 from 2024. In adults with obesity, we suggest against routine screening for 25-hydroxy D. They never mention anything about vitamin D deficiency in obesity. They don't recommend that obese people should be increasing their vitamin D intake. So how do you define vitamin D deficiency? I think you're well aware, of course, you want to measure 25-hydroxy vitamin D. It's the measure for vitamin D status. So how do you know if you're normal or you're high or you're low, right? Because doctors don't have time to look at numbers. They just want to look, is it high or is it normal? So how do you know if you're high? Well, typically lifeguards, right, or people coming back from the Cape Cod vacation, they can have a blood level of 110 nanograms per ml, right? I get a phone call from the PCP saying, is my patient de-intoxicated? And I said, you know what? I do see lifeguards in my clinic. Not so much the Baywatch babes, right? They're 110. Are they intoxicated? I don't think so. The Endocrine Society in 2011 said, based on the literature, you will not become intoxicated unless you're well over 150 nanograms per ml. The 2024 guidelines, by the way, don't talk about de-intoxication at all. But what about that lower limit? How do you know if you're vitamin D deficient, right? Should you be at least 30 nanograms per ml? We did a study with Ann DePapp many years ago in several thousand osteoporotic women, and we looked at PTH levels. PTH levels begin to decline and plateau at around 30 nanograms per ml. We demonstrated that if you're at 21 versus greater than 30, you have 3 times lower risk of having secondary hyperparathyroidism at 30 compared to 21 nanograms per ml. What about the role of sunlight? Right? We did an interesting study looking at Quest Diagnostics data set, 3.8 million samples. So we could actually track for 15,000 samples a day, right, for 2 years, looking at PTH and 25-hydroxy vitamin D. Males were lower than females, but what's really interesting is seasonal variation. And that is that if you live, say, here in Boston, the seasonal variation is much more steep than it is if you live, say, in Georgia. But the peak is the same at around 27 to 29 nanograms per ml, and the nadir is around 19 nanograms per ml. Now, docs will order PTH along with the 25-hydroxy-D, and they relate it. But the question is, are they really relatable? And so we looked at the data as it relates to PTH. So at the time that your 25-hydroxy-D is at its peak, right, the PTH is at its nadir. And when your 25-hydroxy-D is at its nadir, the PTH is at its highest. But what really is interesting, it takes 4 weeks for the PTH to accommodate the vitamin D status. The question, and we don't have an answer for, is it healthy to have your PTH be fluctuating seasonally? And we don't know the answer to that. But I think it's given us an insight that probably we all should be maintaining our blood level above 30 nanograms per ml. Why does the Institute of Medicine consider only 20 as the maximum for bone health? How do we know this? And so it's based partly on this study from JBMR back in 2010. 675 Germans died in an accident, and the pathologist got blood and got the bone and did an analysis of relating the bone here, a normal bone, normal trabeculae, here osteoporotic bone, hardly any trabeculae. And here you have normal trabeculae, but this pink stuff. That pink stuff is unmineralized osteoid. It's what's known as osteomalacia. And what in these German adults relating their bone biopsy to 25-hydroxy vitamin D, they were able to show 26.5% had evidence of osteomalacia and osteoidosis, meaning that you have normal bone that is actually covering the unmineralized osteoid within your bone. And so the Institute of Medicine, what they did was they took this number as the numerator, this number as the denominator, and concluded, well, only less than about 1% of the population had osteomalacia. So it's not a big deal. But what they should have done, right, because this is what Primmel said. He said 100% no evidence of osteomalacia of greater than 30. What they should have done, right, is what you do in high school, right? You take numerator and this should be your denominator. If you do that, between 21 and 29 nanograms per ml, 22% had evidence of osteomalacia. That is one of the fundamental reasons why the Endocrine Society in 2011 recommended you should be at least 30 nanograms per ml for maximum bone health. The preferred range we recommended back then in 2011, 40 to 60 nanograms per ml. Why? Because there's variability in the assay, right? And also based on a lot of other data, including the studies from preeclampsia, for example, 40 seems to be a magical number. So vitamin D deficiency will cause secondary hyperparathyroidism, increased risk for osteoporosis, and this bone disease osteomalacia, right? When you increase your PTH levels, right, your osteoclast number increases and you wind up decreasing your bone mineral density. It precipitates and exacerbates osteoporosis because these osteoclasts are chewing up your mineral and your matrix. And here's a good example, very nicely shown. When you're normal vitamin D sufficient compared to deficient, you're cavitating these lacuna in your bone. You're compromising its structural integrity. Does vitamin D reduce risk of fractures? And so, as you're aware, was the VITAL study. And here's my good friend Cliff Rosen saying people should stop taking supplements to prevent major diseases and extend life. The VITAL findings, a decisive verdict for vitamin D supplementation. Well, I think it's worthwhile to ask the question, what is the VITAL study, right? It's about 25,000 were recruited, right? And it turns out that the baseline, a total of 42% non-trial vitamin D supplements. So 42% were taking vitamin D supplement. Now, supplement manufacturers don't put in the amount. They put in 20 to 50% more. And the VITAL study permitted the individuals to take 800 units a day. So that means they could have been taking as much as 1,200 units a day, right? The mean baseline of this group, look at this, so 16,000 participants. The mean baseline was 30 nanograms per ml, just what Primmel recommended, just what the Endocrine Society in 2011 recommended, right? But they took them and they randomized them. Well, you're giving them vitamin D when they're vitamin D sufficient, right? 64% were sufficient at the beginning of the trial, right? And what percent were less than 20, right? This is what the Institute of Medicine and now the 2024 guidelines suggest, right? 87.1% were greater than 20 nanograms per ml. That would be considered to be sufficient by the IOM. Therefore, 2.4% were by definition of the IOM deficient in that vital study. And there are the data, right? Demonstrated no benefit. Well, you would have expected that, right? 87.1% were considered to be vitamin D sufficient maximum bone health based on the IOM, right? And they make it clear vitamin D supplementation didn't result in significant lower risk, right, than the placebo among people that are healthy, midlife, and older adults who were not selected for vitamin D deficiency, low bone mass, or osteoporosis. I don't know how crazy that is, right? This was not a randomized controlled trial because those in the placebo group could take 800 units of vitamin D a day, right? Subclinical vitamin D deficiency causes osteopenia and osteoporosis. Is it true that these cause bone pain? And the answer is no. Osteoporosis, holes in your bones, is a silent disease. Osteomalacia and rickets is not a silent disease, right? Curiously, your aches and pains are always occurring in the winter. I wonder why. Generalized bone pain, isolated bone pain, muscle aches and pains, nouveau diagnosis, fibromyalgia, right? I showed, and others have shown, about 40 to 60% of these individuals are vitamin D deficient. Here, a very nice study in the Mayo Clinic proceedings, 150 children and adults presenting to an emergency department, aches and pains in bones and muscles, 93% were vitamin D deficient. He's constantly complaining to his dog, my bones and muscles ache. His dog told him, stupid, you're vitamin D deficient. This is why the Endocrine Society in 2011 recommended you want your level to be at least 30 nanograms per ml and improve muscle strength, maintain your bone density, less likely to fall, and less likely to fracture. Is vitamin D deficiency a health problem in the United States? Right? Worldwide, 40% are deficient, less than 20, 60% insufficient, less than 30 nanograms per ml. Here's a very good study, prevalence and trend and predictability of D deficiency in the United States. And look at this, significant in our population, but yet recommendation 12 from 2024 guidelines, in healthy adults, we suggest against routine screening. Right? 60% less than 20 nanograms per ml, African Americans. Recommendation 13. In adults with dark complexion, we suggest against routine screening for 25-hydroxy vitamin D. How do you treat D deficiency? Well, when you go to your gas station, you get a gallon of gas. No. And so what we started back in 1998, because it's the only pharmaceutical available, right, is 50,000 units of vitamin D2 once a week for 8 weeks. Fill up the tank. And then the docs don't know what to do. What we suggested is that after you do this for 8 weeks to fill up the tank, you put them on 50,000 units every 2 weeks forever. It's 3,300 units a day. Now you may wonder, right? Oh my heavens, if you're taking this amount every day for years, is it going to build up in your body fat and cause toxicity? Well, Einstein worried about this. And so we did a study. And we showed after 6 years on that program that these patients of mine all were vitamin D sufficient in that range, 40, 60 nanograms per ml. There was no toxicity. It's equivalent to about 3,300 units a day. We showed that 1,000 units a day will not make you sufficient in the wintertime in Boston. Can you give 50,000 units a month without screening? Right? Because many areas of the world, screening is very difficult because the 25-hydroxy-D assay is not easily available. So we did another study. What we did was we got a blood sample from my patients, and we then put them on this program, and then several years later, got their 25-hydroxy-D at baseline and at the end of the study. And the Endocrine Society in 2011 looked at our study, 50,000 units twice a month. Some at the end started out at a level of 35 to 50. So you would think, oh my heavens, if I had given them 50,000 units every 2 weeks, they'd be intoxicated. Turns out not true. They went up to about 80 nanograms per ml. No one was above 100. So 50,000 units every 2 weeks is perfectly fine. Now here's another issue, right? Here's recommendation 11. In adults 50 years and older, indication of vitamin D supplementation treatment, we suggest lower dose vitamin D instead of non-daily higher dose. Now, I don't disagree with that. I think it's important every day to take it. But for elders who are taking all kinds of medications, taking it once every 2 weeks, having CVS call them up to pick up their prescription, it works very well. What about the intoxication, right? Worrying about hypercalcemia and nephrocalcinosis. We did a study with Bob Heaney many years ago and showed 10,000 units a day in healthy adults will not cause toxicity. Here, a study out of Canada showed 4,000 to 5,000, blood level around 40. 20,000 units a day, 60 nanograms per ml, right? It's equivalent to 120,000, 150,000 units a month, or equivalent to 600,000 units a month, right? What about infants and children? Catherine Gordon showed very nicely to treat D deficiency in an infant, she was giving 2,000 units a day for 6 weeks, or 50,000 units a week for 6 weeks. Perfectly safe. Here, pregnancy. Carol Wagner and Bruce Hollis showed very nicely 4,000 units a day, raised the blood level in the range to reduce preeclampsia, premature births, etc. No toxicity. And the reason is that they actually measured serum calcium. But the most sensitive indicator is urinary calcium. And they showed no change in these pregnant women on 4,000 units of vitamin D a day. Can you become intoxicated? This poor guy went on the internet back in the 90s and he bought this because he wanted to take 2,000 units a day to prevent prostate cancer. And so he took 2,000 units a day for a year, called me up and told me I'm intoxicated. And I said, send the stuff up, we'll do an analysis for you, because I was curious. And sure enough, the company forgot to dilute it. He was taking 1 million units a day. We published him in New England Journal of Medicine. He started out with a calcium of 15 and 20-hydroxy-D of 500. This is intoxication, right? We hydrated him. He became my patient. He was in Florida, but I was advising. We gave him good hydration and diuresis. His calcium quickly came down. 25-hydroxy-D gradually came down. He had no complications from this experience. It's difficult to become vitamin D intoxicated. Why should you care? Because we now recognize, of course, vitamin D is metabolized right in your liver and activated in your kidneys. And essentially every tissue and cell in your body has a vitamin D receptor. Why? Well, the earliest observation, believe it or not, 1979, when Dr. Suda showed 125D would take leukemic cells that had a receptor and make them normal. So this led to the concept of vitamin D in cancer. And so there's a mountain of evidence linking sunlight deficiency and vitamin D deficiency with cancers. Sunbathing could cut your risk for cancer. 1941, it was shown. If you live at higher latitudes, you're at higher risk of dying of cancer compared to living down south, even though you have a higher risk of getting non-melanoma skin cancer, which is easy to detect and easy to treat. And my good friend Cliff Rosen said, well, what else do we have regarding the VITAL study? And so Dr. Manson, the VITAL study, said there was no benefit in reducing cancer or cardiovascular disease. However, she also pointed out there was a 25% significant decrease in cancer mortality. Now, you would think that that's kind of important, right? And she also said that it may take a longer time to be developing cancers, so that the VITAL study may not have been able to pick this up. But then in 2019 came bad news, because it was shown that these patients that were taking vitamin D supplementation of 2,000 units a day, and these are patients with digestive tract cancers that underwent operation and had chemotherapy. And they showed that the primary outcome of survival to time or death, 5 years, zero benefit. This was bad news, right? The conclusion was that vitamin D had no benefit, right? So there it is, the last nail in the vitamin D coffin. But voila, it turns out, if you look at their data more carefully, those that had less than 20 nanograms per ml on vitamin D supplementation had essentially no benefit. However, those that maintained blood levels of at least 20 up to 40, there was a dramatic improvement in survival. So in 2023, this group went back and did an interesting study. And they asked the question, what if their cancer is making a mutation to P53 and that your body is fighting it by developing an antibody? Is it possible that if you do that, does vitamin D help then reduce the risk of cancer death? So can vitamin supplementation reduce relapse or death in a group if they have a P53 immune reactivity in their body, and they looked for the P53 mutant in the cancer cells from the biopsy they had taken originally? And they looked at 99% of the cancer cells. And what did they find? 5-year survival, significantly higher in the vitamin D group, 80% compared to 30% in the placebo group. And so we now recognize that, in fact, vitamin D, very important in improving cancer outcomes, and especially if you have a P53 immune response, 150%. What about your immune system? Well, we know that innate and adaptive immunity is regulated by active vitamin D. And here's Cliff again saying you don't really need to take any vitamin D, right? And so turns out maybe you do need it to be at least 30 nanograms per ml, because Dr. Manson, right, who ran that vital study, all of a sudden they looked at the relationship of vitamin D status during the trial with autoimmune disorders. And they concluded that those that took 2,000 units a day for that period of up to 5 years showed a 22% reduced risk of developing autoimmune disorder. And that includes rheumatoid arthritis, psoriasis, and other autoimmune disorders. We know from early on that children in Finland that were getting 2,000 units a day during their first year of life reduced risk of the autoimmune disorder type 1 diabetes by 88%. So other studies have done out of Harvard Nurses Health Study, women taking more vitamin D reduced risk of multiple sclerosis, about 41%. Here, a study out of Iowa, 44% reduced risk of rheumatoid arthritis. What about COVID? And so it turns out, like I said, vitamin D controls both innate and other immune activities, including regulating T cell and cytokine production. And one of the major complications of COVID was the cytokine storm. And so it turns out that active vitamin D in these cells that are regulating cytokine production will decrease cytokines that are harmful and improve cytokines to help you fight infection. Well, these are nice concepts, but what about data? And so we did a study with Quest Diagnostics, essentially at the initiation of COVID, and asked the question, in 191,000 patients, we had a 25-hydroxy vitamin D level. And we showed that if your blood level of 25-hydroxy vitamin D was less than 34 nanograms per ml, you had a 54% lower risk a higher risk of getting COVID. Above 30, 54% reduced risk of getting COVID. Here, vitamin D supplementation improves outcomes. Study out of San Francisco showed hospitalizations, 22% reduction. Mortality, 45% reduction. We found the same thing at our hospital when we did the study. Overall decreased odds of 67% death if you were vitamin D sufficient when you entered the hospital. This is our data. Overall odds of death, 82% if you were vitamin D sufficient, decreased, and you were normal weight. But those that were overweight, right, with inflammation, they did not benefit as much. Recommendation 1, right, in children and adolescents, they recommend that up to 1,200 units a day reduces risk of upper respiratory tract infections, which is great. But what about adults? It's been shown over and over again that marked reduced risk if you have a blood level of at least 30 nanograms per ml. But again, here is their recommendation, right? Assuming that you're healthy, right? That you only need 600 units of vitamin D a day. What are other evidence for diabetes, right? We know that your beta islet cells have a vitamin D receptor, and 125D stimulates insulin production. And there's good evidence that vitamin D supplementation may help in preventing the progression of prediabetes to diabetes. And so the D2D study was done, 4,000 units a day for several years. And what did they find? No benefit. But when they went back and did a analysis, subset analysis, remarkably, participants who assigned vitamin D supplementation and maintained a level of at least 50 compared to 20 to 29, follow-up reduced risk of diabetes 76% with a 3-year absolute reduction of 18.1%. Right? Here's a recommendation again from the 2024 guidelines. For adults, higher risk of prediabetes, in addition to lifestyle modification, we suggest vitamin D supplementation up to 3,500 units a day. Again, that's fantastic. Except, here it is again, you're a healthy population, you only need 600 units a day. And we know, this is really interesting, CDC estimates that 50% of the US population has either prediabetes or diabetes, but yet they suggest that your population is healthy, you only need to take 600 units a day. All right, so what if you live longer, right? Turns out that a study out of Germany showed reduced mortality by 25%, right? Indeed, recommendation 6, which is really remarkable to me and totally, in my opinion, illogical, is in the general population, ages 75 years and older, we suggest empiric vitamin D supplementation of 900 units a day. Now, you don't start inducing death at the age of 75, right? It's these chronic illnesses that ultimately lead to your death, including cardiovascular disease and cancer, etc., right? So recommending that you increase your vitamin D intake at age 75, to me, makes no sense. And here's a very nice study shown by the Garland brothers that, again, mortality markedly reduced when you're at around 40 to 50 nanograms per ml. So vitamin D deficiency is a disease of neglect, right? Adequate vitamin D is necessary from birth until death. Don't think about a normal level, but a healthy level. How do you know what your healthy level should be? Well, hunter-gatherers, and we do still have them, right? And so study was done by Oxwaldo several years ago showing that Maasai herders and Hasda, their levels are 40 to 50 nanograms per ml. To get there, you would need to be on 4,000 to 5,000 units of vitamin D a day. The goal, in my opinion, should be at least 30, preferably 40 to 60. How much do you need? Here it is, right? 100 units of vitamin D a day, when you're at around 20 nanograms per ml, will only raise your blood level by 1 nanogram per ml. This is where most people are in the United States if you're not taking a supplement. 1,000 units a day will not make you sufficient. I recommend simple. Adults, 2,000 units a day. Children, 1,000 units a day. Obese, you need at least 5,000 units a day. Conquer D deficiency. And the best source, sensible sun exposure, right? You can get it from your diet. You cannot get it from your diet. Indeed, what do? I wear sun protection when I go cycling or when I'm running, but only on my face, not on my arms and legs. What about sunlight, time of day, season, latitude, degree of skin pigmentation? What's a person to think about? Well, there's only one thing to do, develop an app, which we did with the group down in California, Ontometrics. It's free on your Android and on your iPhone, dminder.info. It'll tell you when you can begin making vitamin D anywhere on this planet. It tells you how much you can make, and it warns you to get out of the sun so you don't get a sunburn. And so, like I said, sun protection on my face, not on my arms and legs. And I take 6,000 units of vitamin D a day. My blood level around 80 to 85 nanograms per ml. Vitamin D deficiency is the most common medical condition. If any one of these chronic illnesses turn out to be associated, there's no downside to increasing your vitamin D intake. You don't need to be a genius to know this. We need sensible sun and vitamin D supplement recommendations. It's not a hypothesis, right? So should we be screening everyone? No. But if you're obese, pregnant, if you have malabsorption problems, or if you have hypersensitivity, you need to be tested. Vitamin D association studies were ignored by the 2024 guidelines. Not to bore you with details, but I published recently in Endocrine Practice a comment back for the 2024 guidelines. Look at this. PTH and bone health. The green area is good for you. Osteoid volume from the Prevalence study. Again, 30 nanograms per ml. Here, preeclampsia, greater than 30 nanograms per ml. Premature births, greater than 30 nanograms per ml. Prevalence of peripheral artery disease, infectivity from COVID, breast cancer risk, mortality, all related to your vitamin D status, should be maintained at least 30 nanograms per ml. Vitamin D can improve your health. And I thank you for your kind attention.
That was fantastic. Thank you so much.
My
And
pleasure.
I think we have a lot of questions, Dr. Holick. So if you would take a couple of them, that would be wonderful.
I'm happy to take as many as you wish.
Okay, thank you. I have one to start. Okay. My question to you is that I was a participant in a course that many of us in this group took with a functional medicine doctor who was a speaker here. And during the course, she also advocated, especially if we lived in a northern climate, that we would want to take whatever vitamin D levels we were currently on, and if whatever our scores were, to take at least double that. So I went ahead and I had been taking personally 2,000 IUs, international units per day, and I doubled it to 4,000. And when I did that, my vitamin D level went up to 93. So
Yep.
mine went up a considerable
Yep.
amount higher. It
Yep.
had been 50 or 53.
Yep.
And so my question in saying this is, how can you guarantee that that amount won't be too high? Because
Right.
my doctor said that's too high, and he told me to stop taking it for a month and then to begin taking it again. and just go to the 2000.
Okay.
What would you
So,
say to
so there are two possibilities, right? The one most likely, just seeing you, is that you have very little body fat. I'm not sure what your BMI is, but we did a study with Catherine Gordon many years ago. And even though I went through these slides very quickly, if you looked at that slide at 25-hydroxy vitamin D and underweight, normal weight, and overweight, if you're underweight, it turns out that the body uses your vitamin D better because you don't have enough body fat for the vitamin D to get into. So we did a study in anorexic girls at Children's Hospital and showed that a tiny amount of vitamin D was able to easily sustain their blood levels in a very high range. So I suspect that that's the most likely explanation. The second explanation for some people, I see this in my clinic, is that you can have a partial 24-hydroxylase deficiency. The 24-hydroxylase is the enzyme that when active vitamin D gets in your cell, it instantly induces its own destruction by increasing the 24-hydroxylase. And the 24-hydroxylase clips off the piece of the side chain to make it a carboxylic acid and makes it totally inactive, and it then gets excreted in the bile. 25-hydroxy-D gets destroyed in the same way. So if you have a partial deficiency in that enzyme, people are more sensitive to vitamin D and will raise their blood level. There's a very rare genetic disorder that you have no 24-hydroxylase, and it causes severe hypercalcemia in infants. And for some reason, I've reported this, is that I had 3 patients that developed this later in life. And we don't understand why or what turned the genes off, but you have to be a little bit cautious. And that's why it's always good if you're going to go on a higher dose 8 to 12 weeks later to get a blood level, because we know that once you're on a stable dose, it takes 6 to 8 weeks to get to a new plateau, and it will stay there. Yeah. So you probably, if your level was 50 on 2,000 units a day, you're good, and that's probably the reason.
Okay, and I did that whatever season it was. And you
Yep.
still,
Doesn't matter, because as I showed you in the 2.3 million samples,
yeah,
you only get about 8 or 9 nanogram per ml difference from winter to summer.
okay. Thank you. That's very helpful. Okay, we have a lot of other questions, and I think I have another couple myself, but for starters, let's see where we are here. Well, one question is, why weren't you on the USPSTF panel? Or the US task force that made the new recommendations? Why didn't they include you?
Right. Well, I mean, so I was on, believe it or not, I was on the task force in 2009, because just like the Endocrine Society Practice Guidelines, I was actually on the IOM committee back in 1998, and there was also a committee for non-human primates that I was on as well. But the problem is that I think that whatever agencies are controlling this is they don't want to admit that vitamin D deficiency is a health issue in the United States, because if it is, then they have to deal with it, right? And I think that the way to deal with this is that we need better food supplementation, right? People probably don't know this, but the FDA has given permission, because normally it should be like 100 units in a serving, like 8 ounces of milk. But actually, the FDA is now given permission they can double that if they want, but nobody has.
I also want to make a point that, and thank you, that's excellent. If you would like to speak, I know I see a couple of raised hands. You will be taped speaking, so I just want to remind you of that. Okay, Deborah, did you want to ask? Looks like you're.
Sure, yes. Dr. Holick, thank you for such a great presentation. I was wondering, for your patients, your clients, what supplementation do you utilize besides the sun? And are there, what are your recommendations for supplementation for just, the individuals who are kind of looking to supplement on their own?
So we asked that question because I was concerned. And so any national brand, CVS 2-for-1 sale, for example, is perfectly fine. I just personally take Nature Bounty just because I take the 5,000 unit tiny little capsule, which is really nice. I take a multivitamin which is 1,000 units, and then I take an omega-3, which has 2,000 units. So I get about 6,000 to 8,000 units of vitamin D a day.
And what about food sources besides, supplementing?
Yeah, so herein lies the problem, right? You have 100 units in a glass of milk, right? So you'd have to drink 20 glasses of milk a day to get 2,000 units. Mushrooms exposed to sunlight is actually a pretty good source. And so, and in fact, they tried in the United States and failed to irradiate mushrooms and sell them in the produce section, but it didn't really take off. But most mushrooms now sold in Australia are actually irradiated with UV radiation. Um, cod liver oil, wild caught salmon, because we did a study here in the United States, farm salmon are basically fed junk. And as a result, you would expect they don't have very much vitamin D, 10 to 25% compared to wild caught salmon and herring, but that's it. And that's why vitamin D deficiency is such a worldwide problem, because we always had depended on the sun for our vitamin D requirement.
Really
Um,
good. That's a great questions. Thank you, and great answers. One question that came in on the chat is, I don't know why the USP STF is recommending against vitamin D. I think we're all questioning that because we just have all read those guidelines for people over 60 to prevent not only osteoporosis, but the prevention of cancer. Do you know why they're doing that then? Based on your research, that's definitely refutes that. What happened there?
So like I said, they don't want to look at association studies. They only want to look at RCTs. You cannot, and if you have a chance to read my endocrine practice guidelines, and it's free right now, I believe, is I make it clear what Bob Heaney had said many years ago. You cannot do an RCT and look at a nutrient because there are too many factors involved. How much calcium are you taking? How much magnesium are you taking? How is that related to your vitamin D intake? And so as a result, and these studies are not placebo, which is even more kind of crazy, right? Millions of dollars are being spent. And like I said, the vital study, you could take 800 units a day. I mean, more than 50% were vitamin D sufficient, had a 25-hydroxy D of greater than 30 nanograms per ml. I mean, if you're vitamin D sufficient, you're getting vitamin D, why do you expect there to be a major benefit? You're already vitamin D sufficient. I don't know what to tell you. I mean,
I know, right?
my imagination, and that's why I wrote the endocrine practice guidelines. It came out December of this year. And I'll send you the URL for it so you can give it to your
Oh,
members.
that'd be great.
Download it.
Great.
yeah, that'd be great.
Did Lori, thank you. That's wonderful answers. Lori, did you ask your question yet? Lori
No,
Key?
I did not.
Go right ahead.
Okay, so I wonder what your thoughts were on research studies that I have gone through about higher risk of falls in older people and vitamin D association.
Right.
I experienced a fall shortly after I started, not hardly a senior, but and I noticed that my mom, when she started on a 2000 IU dose, she got very wobbly very quickly.
Huh.
And I just wondered, is there a connection? What you said about low BMI, my BMI has been a little bit low, so maybe I reacted very quickly. Any
Yeah.
thoughts?
Very interesting. I mean, there are studies to show that these very high doses, like 500,000 units every 6 months, increases risk. The one study that was published in JAMA, which really puzzled me, where they concluded that taking vitamin D increased risk of falling, is that the way they did the study, which was that they put out an advertisement and they said, if you've fallen in the past year, please join. So that means that 100% of the people that joined had fallen the year before. And then they gave vitamin D versus placebo. And the group that got placebo had fewer falls compared to the vitamin D group. But the problem is that 100% of them fell the year before. And so I have a hard time understanding how to interpret that. My thinking had always been, but could be mistaken after hearing what you're saying, is that vitamin D deficiency causes osteomalacia and muscle weakness and aches and pains in your bones and muscles. So you're less active. And now you're becoming vitamin D sufficient. And now you're gaining more energy and having less bone pain. So you're more active. So therefore, maybe more likely to fall. But that certainly doesn't explain falling within a couple of days of starting to take 2,000 units of vitamin D a day.
Yeah, so it was a very small dose. I went up very slowly. It started with 250 IU drops, but I also noticed in previous times starting on vitamin D and experiencing very interesting mood shifts.
That's a different story. I mean, there's evidence, at least in animal studies, that vitamin D deficiency causes a decrease in brain serotonin levels, and that vitamin D improves serotonin levels in the brain.
Okay, so that's quite possible. Interesting. Thank you.
Awesome. Dr. Holick, do you recommend vitamin K with D?
Say it again?
Do you recommend vitamin K with
Right.
with
So
D?
this is very controversial. So uh, in my opinion, and I'm right now editing with Jerry Neves, our third edition of Nutrition and Bone Health, right? So we look at all the nutrients and all the impact. Sarah Booth had written the definitive chapter on vitamin K and concluded that it was iffy at best, right? And so the concepts out there are incorrect. Vitamin K has nothing to do with vitamin D absorption. Vitamin K has nothing to do with vitamin D action, right? Vitamin K will gamma carboxylate some proteins in your bones, right? And the study out of Holland suggested, and there's a study out of Japan suggested, that if you take a dietary history, those that had vitamin K higher intake were less likely to fracture. And so as a result, they've kind of amalgamated this information to conclude that you have to take vitamin K in order for vitamin D to work, because vitamin D increases intestinal calcium absorption, and the vitamin K intelligently tells the calcium to go to your bones and not to your blood vessels.
Right.
Well, to me, I'm sure vitamin K is very intelligent, but I'm not convinced, right? Vitamin K, as you know, if you have a good green, if you have a healthy diet with green vegetables, right, you should not be vitamin K deficient. But if you are, it's reasonable to take. And I told my patients, look, if you want to take it, perfectly fine with me. It's not going to hurt you, right? Unless you're an anticoagulant, right? But I'm not sure that there's a very good connection.
You know, I'm curious what you think of this. We've had a person on, I'm sure you know some of her work. Her name is Dr. Morgan, Sarah Morgan.
Yes?
And I just wonder, she often talked about how nutritional studies are so difficult because everyone that you're measuring starts out with a different dietary history and continues with a different diet and a different, you know, their vitamin levels are different. And how do you actually compare A and B? And I wonder do you have any comments about that?
Well, just like I said before, that the placebo-controlled trials, which A are not placebo, but B nutrient studies, you can't really do a randomized controlled trial. You have too many variables.
Right,
Yeah.
yeah. And so many nutritional studies are like that.
Right. And they come out with this conclusion, and then all of a sudden people think that that is the holy Bible of information, and it's not.
Thank you. Um, Karen, Kachich, would you like to ask a question, Karen?
Yes, thank you. I'm finding this very fascinating and kind of piecing things together. When I was diagnosed with osteoporosis, I was very low in D. I was at 15 and started taking 2,000 milligrams a day, and quickly came up to 40, and then 44, and now I'm at 49. But through a program that I'm doing, I'm doing a ton of testing and tracking of things like glucose and blood pressure. And what I'm finding is that my calcium now is tending a little bit toward the higher side if I am taking supplements and trying to hit that 1,200 milligrams a day. So is it reasonable that people metabolize D differently and their body responds differently, so that in my case, for example, I may be receiving optimal calcium at like 600 milligrams because my just where my D is, and my body's now processing D appropriately?
So, in my opinion, we actually, and we've done some studies looking curious about this as well. It's the active form of vitamin D, right, made by your kidneys that regulates intestinal calcium absorption, right? And so we asked a simple question. We gave an additional 1,000 or 2,000 units of vitamin D a day, and we measured the 125D levels over time. They never changed. What really controls your calcium is not vitamin D, it's your PTH, right? Because PTH, when it goes up, increases tubular reabsorption of calcium. It helps you conserve your calcium. So even if active vitamin D in your gut is increasing intestinal calcium absorption, if you can't conserve it in your kidneys, it doesn't make any difference. So it's your calcium sensor in your parathyroid glands that is totally controlling your blood calcium. And it does it by regulating how much calcium is being excreted, and it regulates how much 125D is being made to go to the intestine to absorb calcium from your diet. So the fact that you increase your calcium and your PTHs and your calcium is going up, you have to really also look at your PTH level and to see what's happening with it as well.
So my calcium went to 10 and my PTH went to 22. And so I don't want to over suppress the osteoclast activity as well.
Okay.
Like,
That's
okay, where's my balance here?
good. So now that's a different story. So that means it's possible. Did you measure your 125D level?
I'm not 125 is the one that's not typically measured, right?
Exactly. That's the
No.
one you want to measure. Because the PTH of 22 is almost suppressed. So, and the calcium going up means that you have something else going on. And it could be granulomatous. You're producing more 125D in an unregulated manner, for example. But PTH of 22, I would be very interested in, and with a calcium that's rising, there's something going on. It's just not simply by increasing your vitamin D, other than you have a granulomatous disorder that's converting 25 to 125D and increasing calcium absorption.
Interesting. So I should be going to my endocrinologist and
Yeah, I mean, at a minimum, I would get 125D and to see what that level is. Yeah. And then there's a whole differential diagnosis. But yeah, if I was seeing you in my clinic, that I would be working you up.
interesting.
Yeah.
Okay.
Because I think that I don't know what which assay, PTH assay you're using. Usually it's around 15 or so, but we showed that you have to really be. We did a study for 6 months, and we put people on 600, 4,000, and 10,000 units a day. And we looked at gene expression. I didn't have time to talk about that here today, but we showed that if you're on 10,000 units a day and you raise your blood level to around 80 or 90, that your PTH levels will go down to 20.
Hmm.
So, but that's, I'm sorry, when you say that, the D that you're talking about is the one that we typically not measure, not the
Right.
20.
Right. Because so for if you have sarcoid, for example, or a fungal disorder or TB, for example, these people, they have a granuloma, and these granuloma have activated macrophages, and they convert 25-hydroxy-D to 125-D, and that's the etiology for the hypercalcemia. Right. Also, in rare lymphomas, we see the same thing. So
Okay.
125D would be very worthwhile, and you're welcome to stay in touch with me by email.
Okay, thank you. I think I will email you. I did go off of calcium supplements. I just took, and in fact, I think for the following week, I dropped my D also. I didn't remeasure my D because it goes down so slowly, but by eliminating my calcium, I would still have a glass of milk and some yogurt every day, and my calcium came down to 9.1.
Yep, good. But it sounds like there's something going on. It's
Okay.
just not, yeah, it's just not simply increasing your vitamin D would do that. Not under normal circumstances.
Okay, I will email you. Thank you.
Yep.
Yeah, that's great. I wonder if you'd have time to address area that you're a special, well, it's another specialty of yours is that the Ehlers-Danlos
Yeah.
syndrome. Um, could you
And
speak
I'm
on
happy
how?
to come back and talk about that separately.
Okay, I know that probably is too much
Go
to
ahead.
ask.
No, but ask the question.
Well, someone wants to know, how about the vitamin D levels in people that have that syndrome? Would
Right.
you, would
It
you,
has no impact.
oh,
Yeah, none. Because Ehlers-Danlos is the alteration in your collagen elastin matrix, and 125D has no effect. We've looked at that over and over again. Good
good
question.
to know.
Yeah.
Thank you.
But if you should be interested in Ehlers-Danlos, I'd be happy to give a talk. Its implications are enormous, and basically no one realizes they even have it. And 1 to 3% of the population does.
Wow.
What are those, what does
So
it present like?
some of them are real simple, which is if you get up quickly and feel lightheaded, right? And your doctor tells you you're dehydrated, drink more water. Yeah, no, it's postural orthostatic tachycardia syndrome. If you prefer smaller meals and don't like a normal sized meal or a large meal, likely have gastroparesis associated with dysautonomia. If you have migratory pains, aches and pains that are not related at all to an increase in sedimentation rate, likely due to regional chronic pain syndrome, again associated with this. And if you have hypermobile joints, if you're able to touch the floor with the palm of your hands when you were younger, if you bruise easily, the list goes on. And what's even worse is that for children, increases risk of fractures. And I got heavily involved and embroiled, unfortunately, in a controversy that cost me my job because I've been helping families who've been falsely accused of child abuse because their infants had 32 fractures, various stages of healing, when the infant actually had EDS, right? And then also young women, if they have this genetic disorder, many of them have severe dysautonomia, and it can lead to their death. One, I'll send you a movie trailer called Complicated. It's just been accepted by a Slam Dance Film Festival, and therefore it's been going to be nominated potentially for an Academy Award. It will be one of the most gut-wrenching movies that you will ever see. I'll send you the trailer.
To see that, and I'm sure everyone here would too. Gosh, very
Yeah.
interesting work you've done. Let me just make sure I'm not hogging your the time on here. Is there anything you could talk about in terms of magnesium and its relationship to the vitamin D? Because
Right.
a lot of us take calcium, vitamin D, and
Yep.
you
Yes.
know, what do you think of magnesium?
Right. So my opinion is same thing for vitamin K, right? If you have a healthy diet, you're probably getting an adequate amount of magnesium. Magnesium deficiency, the major cause, believe it or not, is twofold. One is that if you drink a lot of alcohol, because alcohol causes you to lose magnesium in your urine. And so alcoholics are chronically magnesium deficient, and it often can cause seizures and tetany, independent of being hypocalcemic. If you're hypomagnesiemic, you cannot release and make PTH. And PTH plays a role in activating vitamin D. And PTH plays a role in maintaining your calcium through your kidneys and through your bone. And so as a result, hypomagnesemia and actually hypermagnesemia will do the same. It will shut down PTH function and cause you to develop hypocalcemia. But elders are also much more likely to become magnesium deficient because of their diet. And so for elders, many of my elder patients, I thought it's very reasonable for them to be taking magnesium supplementation. It won't hurt you because any excess is sent right out into the urine, right? And as you're well aware, but doctors usually aren't, is that most magnesium is intracellular. So measuring a blood level of magnesium tells you little about your true magnesium status. Right? The way you figure out your magnesium status is that you take a magnesium load of 1,000 milligrams or so, magnesium oxide, and then you measure a 24-hour urine magnesium. If you spill magnesium, your tank is full. If you have minimum spilling, that means you have a severe deficiency. And alcoholics, for example, that I would see at Boston Medical Center, I mean, they would have like 5 to 10 gram deficit of magnesium deficiency. Yeah.
Interesting. Two last questions, because I know we've overstayed your
And I
time. Thank you
apologize for
for,
being late. So, yeah.
I know, thank you. One question that I thought was excellent, someone threw in our chat is there a blood panel that we should make sure that our provider will run for us? Those of us that have, this is a group of people that are concerned with our bones. What would be your recommendations there?
So this is what I did before I was fired for helping these poor families. And that is were women coming in with low bone density osteoporosis, right? I was actually very strong proponent for hormone replacement therapy, unless there was issues of family history or personal history of breast cancer. And you have to worry about insurance companies, okay? But what I would typically order on my patient for seeing for the first time is 25-hydroxyvitamin D, PTH, a complete metabolic profile, so LFTs, kidney function. You want your total calcium. You have your albumin, and then I got phosphate, which often is never ordered because that helps you understand the PTH function reasonably well. And then if I'm thinking about putting them on a bone active medication, I get either P1NP or osteocalcin, a measure of bone formation, your osteoblast function, and then either a serum CTX if it's available, or a urine NTX, which is a measure of osteoclast activity. And the reason for that is that bisphosphonates, for example, they are for inhibiting bone resorption, right? Well, if you have a patient that comes in with low P1NP or osteocalcin and low CTX, that means they have adynamic bone disease, right? They have very poor bone disease. They're not likely to respond to these anti-resorptive agents, right? So to me, it's very important to understand the bone remodeling activity of your patient, independent of calcium, phosphate, 20-hydroxy-D, and PTH, right?
Absolutely.
They used to make a big deal about 24-hour urine calciums, and then worrying about, and in the one case that we just talked about hypercalciuric, hypocalciuric hypercalcemia, right? It turns out that even though it looked to be really a great study out of Israel showed it's of no benefit at all. And we actually found the same thing. You could have a patient with parathyroid adenoma that has 0 calcium in their urine, and you think they have this familial genetic disorder, and they don't. So 24-hour urine calcium, I usually don't find to be helpful.
Oh, interesting. It's, we just saw a report today that Lisa Wadowski, one of our members, shared with me, that said that the several insurance companies are no longer going to be covering the vitamin D levels.
Yep, not surprised. Yeah, because that's what the 2024 guidelines did.
Yeah.
It's really very unfortunate and sad. So my recommendation to everyone is take vitamin D supplement and then not to worry. And like for you, especially if you're very thin, 2,000 units a day, all that you need. But if you're normal weight, overweight, you need probably 3,000 to 5,000. And if you're obese, you need at least 5,000 and up to 10,000 units a day.
Awesome. All right. Well, I know we've had lots of other questions. Maybe we can have you back sometime.
I'd be
It would
happy to
be
come back.
wonderful.
Great,
Yeah.
great.
Great. Um,
Thanks so much for your attention. It's a real pleasure, and I do apologize for
no, we
That's okay.
appreciate you, and I thank you very much for your time. It's a
Yeah.
wonderful program.
Have a-
Thank you.
Thank you.
Thank you.